We got them triggered, y'all. Healthcare triggered them again. Oh, man. What is going on here? Hey, y'all see that tree? That tree. Yeah, fall in Tennessee, looking good. Yeah, we thought that the buy versus own real estate was going to get them fired up. Boy, this healthcare brought them out. Boy, it brought them out big. Anyway, before we get started talk about it, do me a favor, like this video, subscribe to the channel, hit that notification bell. I'd appreciate it. Assuming that you want to hear from me, I'd appreciate it. So anyway, yeah, man, that just got them pumped up, got them fired up, and I figured it would, right? Healthcare, everybody's getting their statements, they're getting their renewal, open enrollment, November 1, here we go, and people are getting absolutely drilled. And I knew it would stir it up. But you know what kills me about all this, I'm walking up this big hill again today. Not doing it fast because I'm trying to talk too. But anyway, we're going to get through it. How polarized everybody is. It's unbelievable. It's literally 50-50 down. Just down. You're either on one side or the other. And there is hardly any in the middle. You know, I get it. I get it. I do. But you want to know what? At the end of the day, we're all in this together. Whether you think that it's Trump's fault because of the shutdown and because of the big beautiful bill and he got rid of the subsidies and all this and you get what you deserve because you voted for him and blah blah blah, or you're on the side of it's Obama and McCain was the vote and Obamacare and ACA and all that, and if we didn't have that, you know, which is more the camp that I'm on. But at the end, either way, we're all getting screwed. That's the funny thing about it. I mean, because we all are. There's very few people out there that think that they're getting a good deal with healthcare. Very few, regardless of what side of the aisle you're on. So what are we going to do about it? We got to do something about it. At some point, we've got to set the politics aside, look at the facts, sit down and talk about this and get this solved once and for all. Or significantly better than what we've got right now. And if you are one of those that maybe on the left or whichever, and you're like, I'm down with you. We need to finally just put this down and put our right left down and solve this. Because is there anybody out there really, honestly, that thinks that a $3,000 a month premium and a $21,000 annual out of pocket at the grand total of $51,000 a year is good? I mean, raise your hand. Like this video if you think that paying $51,000 a year for health care is good. Right or left side, Republican or Democrat, Libertarian, you know, whatever you are. I don't even give you a name from America. If you just take all of that out, how's that good? And then say, well, if you're not going to get the coverage, if you're not going to, then what are you going to do? What are you going to do when you go in, you have to have a major procedure and it costs $300,000 and you're going to be financial ruins? Wait a minute. Let's stop. Take the politics out and let's talk about that right there. $300,000 for a procedure. Is there anybody out there that's watching this video right now that thinks that any procedure that you have done is worth $300,000? A house, pretty nice, not much right now, but not long ago that was actually pretty good. That is insanity. And you say, well, okay, if it's not $300,000, what should it be? A lot less than that. You know, I'm not going to put an exact number on it, but if you think that $300,000 for a heart attack or whatever is oh yeah, that should be high, it should be triple that. I got to hear from you. Yeah, I like this video. Come on, it has nothing to do with the politics. It's just when you look at getting a heart or cancer or something like that to get care that costs you that much. Is that reasonable? I mean, heck, even attorneys don't make that kind of money. I mean, that's just so okay. What is the doctor making of that? Okay, and then what is the hospital? We have to look into why these charge. You know why? I'll tell you why. There's 5 entities involved in this whole process. This is where the problem involves. You got the patient, you got the doctor, you got the hospital, you got the insurance company, and you got the government. All 5 of those entities got their fingers in this pot. That's a lot. Because usually when I go to a store and buy something, it's me, the buyer, and the seller. And they sell, they put a price, I go in, I decide if I want to buy or not. 2 people. Anytime you add more than 2, 3, so if it's you, okay, the insurance company and the doctor, hospital, that's 3, 4 of it. And then you add the government in there. So you got 5 entities that are involved in this process. And guess what? There's only one of them paying. Really? You said, well, no, the government's, where do you think the money comes from? The government has us. Who's getting screwed? We are. The patient. Only one out of those 5 entities is getting screwed. Do you think they care what side of the aisle you're on? No. They're out to get your money. They don't care. So that has to change. That has to change. So, okay, you're like, that's great, Gen X guy. How are we going to solve this? What are we going to do? Well, I've got a couple solutions, and without getting all complicated on this, because this could go on, this video would be 100 hours before we got done with it. One thing that has to happen is we ought to be able to buy health insurance anywhere in the United States. None of this of Tennessee, of Ohio. Get rid of that crap. What is that? Well, nothing. How works that like that? Only government crap works like that. Why does it have to be that way? If I want to go buy health insurance in North Dakota because they're going to cover me in something that I agree that I like the coverage and the price and all that, I should be able to buy it for them, and they should be able to cover me. And you want to get prices to come down? That's how you do it. You do that. You let these jokers compete. These insurance companies compete with each other. That's the number one thing. I mean, this is just business 101. If I'm selling a product and the guy across the street selling a product, okay, we've got a couple choices. I'm either high and he's low, okay, or he's high and I'm low, or we're the exact same price. That's the 3 options, right? So if I'm low and he's high, cheaper's not always better, because he may be offering something better than I am, even though I'm lower, and then flip it around the other way. And if we're the same price, that takes that variable out of it. So what is the differentiating factor? Service, quality. Sometimes cheaper is not better. I've bought a lot of things that are more money than cheaper because I perceive or know the facts, or have researched or used it, or have been involved with it to know that it's not, the more expensive one nets me less in the end. That's another thing we're going to talk about, nets versus gross thinking. We'll get on that one another time. But anyway, so yeah, we've got to get these jokers competing on the price of this stuff. It has to change. Government has to be less involved. Now, I'm not saying no regulations in healthcare. I think there do need to be regulations. I'm a less regulation guy, especially on small businesses and entrepreneurs. We've got to quit handcuffing them to be able to be productive in producing. Because I don't know if y'all realize this or not, but the engine of this country is not big corp. It's the people like me and the small business owners out there, the ones that really make this place tick. Get rid of them and you watch your country go down the tubes in a minute. So we've got to start regulating this stuff, but in a very meaningful, smart way, right? And so, like, for instance, pre-existing conditions. I don't think America's built, no matter which side of the aisle you're on, I don't think that any of us are here. If somebody's in need, that we're not going to take care of them, whether they've got insurance or not. We've already proven that. We're the most compassionate nation on this planet. Whether you're hard right, ultra compassionate people there, or hard left, there's ultra compassionate people there. And there's everything in between. We are a very compassionate nation. And so when somebody has a pre-existing condition, we can't deny them care. We have to come up with a solution for that. At the same time, we can't have insurance companies going, well, this guy has got a pre-existing, or woman, whatever, whoever, has a pre-existing condition, and they're going to cost us $100,000, and we're only going to collect $10,000 worth of premiums from them. We're down 90 grand. We're not going to keep them going. And I get that. I mean, from a strict dollars and cents perspective, the math don't math. But we still have to take care of those people. So we have to come up with a solution for that. And, there's a whole crowd out here that's, and you see it in the comments, that's, this whole thing was designed so one payer, universal, single payer, universal health care, blah, 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 blah. Yeah, maybe so. True. Okay, I don't disagree with that. Yeah, it was all designed so we go to a single payer and all that. And I'm not going to sit here and say, no, that's not the answer. It might be. But I want to try the competitive side first. I want to get these, I want to turn the script on this, and I want the insurance companies and these hospitals and these doctors, I want them to start competing. And I want us to have regulations that prevent them from colluding. And if they do collude, there's a massive, massive consequence if you collude. If any of you entities that's other than the patient collude, and even if you're the patient and you're colluding with them, there should be punishment for you. But that's like, when is that going to happen? Like, very rare. That's not at the top of the hill. We're going to go back down the hill. There can't be any colluding of any of the 5 entities, but it's not, I don't think the patients are doing much of the colluding. Let's just go ahead. I think we can all agree on that. But the other 4 entities, that's not allowed. If you get caught doing it, the penalty needs to be so severe that you will never see the light of day again. You want to stop the behavior? That's what you do. You pass laws that makes this punishment so severe that they won't think about doing it. And if they do it, you punish them to the maximum extent that you can, and you make a public example of them in front of the whole world. You want to stop it? That's how you stop it. You get serious about it, and you turn the screws, and you drop the hammer down, and you say, it's done. Enough is enough. And is that right or left? Why does that have to be right or left? I think does anybody that's on either side, if you think that you disagree, that you think that it should be, that they should collude and they should be able to do whatever they want to the payer, the one person paying the bill, hit that like button below. And if you're the opposite, hit that like button below. Thank you. I appreciate it. Anyway, back to our regular scheduled program. We have to, this whole thing needs to change. It has to change. We have to be done with it once and for all. And I don't know that we'll be completely done with it once and for all, because this is this is not an easy problem to solve. This isn't just, hey, let's go in a room for 5 minutes and just chat this one out, and we'll get back to you in a few, and we'll let you know how it goes. I mean, no, this is a complicated thing. There's a lot of dynamic stuff. Here's another one. And I think a lot of people agree with me. If you're smoking 750,000 packs of cigarettes per nanosecond, and you are eating the entire Hershey factory, chocolate factory, every 2 or 3 nanoseconds, why should I have to pay for your decisions? How's that right? How's that fair? How's that fair? And, but we're American, you should be able to free to do whatever you want to do. Okay, yeah, I'm down with that. But we shouldn't have to be punishing people who make good choices for those who don't. So we have to solve that. How you do it? I don't think I have the answer on this video. But I'm willing to go sit with a bunch of people at a very high level to solve the problem and help figure it out, which ain't going to happen. But I just want to lay that out there in case there might be somebody who's listening. Doubt it, but we'll see. We got to open these borders up. We got to make sure we take care of pre-existing conditions. I think that most Americans are pretty compassionate and think that's the right thing to do. We got to we've got to have some regulations here, and we have to make the penalty be so severe for the doctor, the hospital, the insurance company, and the government. Now, the government, we know their self-accountability is complete and utter awful. It's garbage, I guess. That's my favorite word, I guess, right, everybody? It is. I mean, it's just, that has to change. So, yeah, I knew this was going to fire some people up. And because it's the topic of the moment, right? It's open enrollment. People are starting to figure out their health insurance for next year. And look, even if you're employed by an employer that's, gets part of your benefits is healthcare, yours is going up too. I mean, it's just like, but I think it's pretty safe to say that from ACA and Obamacare to now, it hasn't fixed it, folks. Now, if you're in the very low income brackets, you're like, oh yeah, I don't pay any for health care. It's great. Well, I guess it is great. But if you're not and you're in this higher end, surely you can say, yeah, 50 grand a year. I mean, nobody pays that. Most people don't even pay that in a house payment to live, just to have a shelter. Yeah, health care is important, but I mean, come on, people. Really? I mean, this isn't that hard. Everybody knows that is not sustainable. And guess what? That's on a Blue Cross and Blue Shield Tennessee base plan. We're not even talking about silver and all these upper. I didn't even look at those. I mean, you're talking $5 grand a month? And they're like, oh, well, Gen X guy, you're lucky and fortunate. Boy, if I hear those words again, that you can afford it. I don't want to hear that crap again. Let me tell you why. Everything that I've done hasn't been because I was lucky. It was, you know what luck is? Luck is the crossroads between preparation and opportunity. Dad used to tell me that growing up. No such thing as luck. No such thing as luck. Luck is a crossroad between preparation and opportunity. You make your own luck. So I didn't get lucky. Oh, and if I did, because I made it myself lucky. It wasn't because it's just because of the date and the time of year it was that I just happened to get lucky. No, I earned everything I've done with every business that I've created debt-free. All right, so I don't want to hear all this. Well, you're fortunate enough that you can pay the $5,000 or $6,000 a month. Negative. That is not justification for running the price up so others can get free health care that don't take care of themselves. Here's something else we need. Catastrophic needs to come back. Catastrophic needs to come back because I would be interested in catastrophic. Why do we not have that? Why not? There's a lot of people out there that just, they got great assets, they take care of themselves, and they want to be covered in the event of that $300,000 bill that may come up. And look, folks, I'm not sitting here saying, I don't want to pay it, and I'm not going to pay it. But that's not a choice that I would prefer to make, okay? Well, you don't. You can just pay it. No, because I know that if we don't take a stand and if we keep paying it, nothing's going to change. The only way we're going to get it, it's not just by voting. It's not, voting hasn't done, look, y'all have even said it. Voting has not changed anything. One bit. It doesn't matter which side, it's all crap until it gets fixed. You can blame Trump all you want, and I can blame Obama all I want, whatever. Either way, it's still not getting fixed. So I hope we can at least agree we need to get it crap fixed, okay? So this is just, oh, Lordy. Hey, what can I say? It's a disaster. We've got to come together and get this fixed. And, there are other solutions out there. My choice is right in this moment, I'm not paying it, but I'm not saying that that's just the end. That's not my preference. I do want coverage. I'm not one of these to just, I prefer to have the coverage, but I refuse to do this. I demand change today. And so for all of you out there that have come into the comments and you have offered other alternatives like the catastrophic, I didn't realize that it has come back. I thought it was gone. There's also short term has come back too. Golden rule, I've been looking into it. It's come back, and we had that at one time before when you was a penalty and the rates. We've been dealing with this stuff since 2010, 15 years, and the amount of money that I've paid into healthcare is mind-boggling. And if I would have invested that, I could truly go self-insured. And if it was a $300,000 bill, no problem. I could pay it. I mean, that's what, when you look at it and like what have I been doing? It's insane. So we have to band together. So for all of you who have been out there that have put comments below and not been just a keyboard warrior posting a bunch of garbage that just is doing nobody any good, I appreciate you. I appreciate you rising up to the occasion and accepting my challenge and request for comment. And if you came with a comment that was like, hey, Gen X guy, have you thought about this? And even if there's people out there that disagree with me and that have been very tactful and very smart in their comments and not in saying, hey, or it could have been a fact that I may have had wrong or detail, and they correct me on that, and they're absolutely right, and I was wrong, and I'll admit that, no problem. And I appreciate you that come in that say, hey, this is what I think. Have you thought about it this way? Or what about this, and this, A, B, C, X, Y, Z? I appreciate that. That's how we get stuff done. And we may not agree still after it, and we may have a little bit of back and forth and butt heads a little bit, but that's okay. That is called productive debate. At the end of the day, I'm understanding your position and you're understanding mine. Now, we may walk away from it where we still don't agree and we still think each other's wrong, and that's okay too. That's just the way debates go. But to sit here and just start being non-productive and just posting this just nonsense is all it's doing is just making it more worse. So I appreciate y'all out there on this video and the rent versus own video that I did on owning versus renting. I appreciate the ones out there that bring perspective and different thoughts to the and look, I'm all about inputs. I'm all about, I want to hear, and look, if I'm wrong, I'm wrong, and I'll admit that I'm wrong, and I'll also pivot. I'm not so stuck in my ways that I'm not going to change. If the facts change, and we're going to talk about that in another video, being able to pivot and make changes because things change. And if you're not willing to pivot, you're not going to get very far. You're going to be stuck in the mud. So anyway, that's it. I knew I was going to trigger some people out there. I wanted to do a follow-up to the video and thank all of you who got involved, and more than just insults and just ripping people to shreds or all that. And I may have been guilty about that a little bit on some of mine too, and I apologize. So we're not going to solve it unless we come together and set all of our political divide aside and just look at the facts and look at the number and make sure that we're doing the best for America as a whole. That's what I care about more than anything. I know we're not perfect. I get it. We never will be. But in order to be better, we've got to be able to sit down logically and reasonably and get rid of the agendas and all this other stuff and solve the problem. So anyway, that's the video for the day, guys. I appreciate you tuning in. Do me a favor, like this video, subscribe to the channel, hit that notification bell if you would. And I appreciate all you newcomers to the channel. It's growing. It's great. I appreciate you being here. Tell your friends, tell your family. Appreciate you, Gen X guy out. See you. Bye.